Hello there guys, welcome back or welcome if you're joining for the first time. In today's video, we're looking at factors that affect inter-individual drug response. Like we said in our pharmacogenetics and genomics video, you could have the same disease, be given the same drug and have vastly different reactions to that drug. It could be therapeutic success, therapeutic failure, or toxic events. Now, this reason from factors affecting both the pharmacokinetic and pharmacodynamic attributes of a drug. Now let's take a look at the first factor, which is volume distribution. This can be affected by total body weight, tissue composition, and sex space variances. So an increase or decrease in volume distribution will affect how a drug affects you. If there's an increase in volume distribution, there's going to be less drug in circulation, and if there's a decrease in volume distribution, there's going to be more drug in the circulation. So this can either cause toxicity or reduce therapeutic effects. Now, another factor here is age. Age will determine how a patient will absorb, distribute, excrete, and metabolize a drug. And you can see a good example here with pediatric and geriatric patients. So you can just simply pause the video to see how pediatric and geriatric patients have a difference in their absorption, metabolism, excretion, and distribution of a drug. Now, the next factor here is pregnancy and developmental vulnerability. First of all, in pregnancy, the patients we have an increase in VD, hepatic metabolism, and renal excretion, which will reduce drug concentration in the blood. And also, there will be decreased plasma albumin, which will increase the ratio of free drug to those binds to albumin. Another thing is that there's a risk of teratogens. Now, teratogens are agents that will cause structural or functional abnormalities in development of a fetus. And you wouldn't want that for the baby. Examples of non-teratogens are androgens, cytotoxics, alcohol, warfarin, retinoids, lithium, and life vaccines. The next factor is diet and disease. Now, for example, now you have an hepatic issue. Definitely there'll be slow or impaired metabolism, and also there'll be hypoalbuminemia, which will affect drug distribution, especially for protein-bound drugs. Now, for diet, basically, presence of food in GIT will slow down the drug absorption. Another factor is alcohol. Alcohol can either induce or inhibit cytochrome P450 enzyme. Now, someone who is a binge drinker who doesn't drink all the time, when he takes alcohol, it will inhibit cytochrome P450 enzymes. But someone who drinks regularly will induce cytochrome P450 enzymes. So that will affect metabolism of a drug. The next factor is pharmacogenetics, which we have discussed in a previous video. The bottom line of this factor is that whether patients have the same BMI, height, weight, and every other thing, they are genetically different, and as such, the drug will affect them differently. So we've seen how different factors can affect how a person responds to a drug, and that's why there is now a shift in medicine to precision or more personalized medicine as going to better help your patients.